In this video by DecPlate we will understand the VA rating for dermatitis, eczema, and other skin issues. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. If you're a veteran dealing with skin issues like dermatitis, eczema, or other related conditions, this video will help you understand how these conditions are rated by the VA. Most of these conditions are rated under the general rating formula for the skin, Diagnostic Code 7824. Diagnostic Code 7806, dermatitis or eczema. Dermatitis and eczema are common skin conditions that cause inflammation and irritation. The VA evaluates these conditions under the general rating formula for the skin. This formula considers factors such as the percentage of the body affected and the need for systemic therapy. Diagnostic Code 7807, American, New World, Leishmaniasis. American leishmaniasis, also known as Espundia, is rated based on the most predominant symptoms. Disfigurement, use Diagnostic Code 7800. Scars, use Diagnostic Code 7801 to 7805. Dermatitis, use Diagnostic Code 7806. Non-cutaneous visceral leishmaniasis is rated under Diagnostic Code 6301. Diagnostic Code 7808, Old World Leishmaniasis. Old World Leishmaniasis, Oriental Sore, follows a similar rating approach. Disfigurement, use Diagnostic Code 7800. Scars, use Diagnostic Code 7801 to 7805. Dermatitis, use Diagnostic Code 7806. Non-cutaneous visceral leishmaniasis is rated under Diagnostic Code 6301. Diagnostic Code 7809, Discoid lupus erythematosus. Discoid lupus erythematosus is rated under the general rating formula for the skin. This condition should not be combined with ratings under Diagnostic Code 6350, which covers systemic lupus erythematosus. Diagnostic Code 7811, tuberculosis leprosa, lupus vulgaris. For active or inactive tuberculosis leprosa, use sections 4.88c or 4.89 for rating, depending on the specific circumstances of the condition. Diagnostic Code 7813, dermatophytosis. This code covers various forms including ringworm of body, tinea corporis of head, tinea capitis of feet, tinea pedis of beard area, tinea barbae of nails, tinea unguium, onychomycosis of inguinal area, jock itch, tinea cruris, tinea versicolor. These conditions are evaluated under the general rating formula for the skin. Diagnostic Code 7815, bullous disorders. This includes a range of severe blistering conditions such as pemphigus vulgaris and bullous pemphigoid. They are rated under the general rating formula for the skin. Complications and residuals of mucosal involvement, ocular, oral, gastrointestinal, respiratory, or genitourinary, should be rated separately under the appropriate diagnostic code. Diagnostic Code 7816, psoriasis. Psoriasis is evaluated under the general rating formula for the skin. Complications such as psoriatic arthritis and other clinical manifestations, such as oral mucosa, nails, should be rated separately under the appropriate diagnostic code. General rating formula for the skin for Diagnostic Code 7806, 7809, 7813 to 7816, 7820, 7822, and 7824. To qualify for a 60% rating, one of the following criteria must be met. Characteristic lesions involving more than 40% of the entire body or more than 40% of exposed areas affected, or constant or near constant systemic therapy including, but not limited to, corticosteroids, phototherapy, retinoids, biologics, photochemotherapy, psoralen with long-wave ultraviolet A light, PUVA, or other immunosuppressive drugs required over the past 12-month period. A 30% rating is assigned if one of the following conditions is present. Characteristic lesions involving 20 to 40% of the entire body or 20 to 40% of exposed areas affected, or systemic therapy including, but not limited to, corticosteroids, phototherapy, retinoids, biologics, photochemotherapy, PUVA, or other immunosuppressive drugs required for a total duration of 6 weeks or more, but not constantly, over the past 12-month period. For a 10% rating, the following criteria must be met. Characteristic lesions involving at least 5%, but less than 20% of the entire body affected, or at least 5%, but less than 20% of exposed areas affected, or intermittent systemic therapy including, but not limited to, corticosteroids, phototherapy, retinoids, biologics, photochemotherapy, PUVA, or other immunosuppressive drugs required for a total duration of less than 6 weeks over the past 12-month period. A 0% rating is given when no more than topical therapy required over the past 12-month period. Characteristic lesions involving less than 5% of the entire body affected, or characteristic lesions involving less than 5% of exposed areas affected, or rate as disfigurement of the head, face, or neck, Diagnostic Code 7800, or scars, Diagnostic Code 7801, 7802, 7804, or 7805, depending upon the predominant disability. This rating instruction does not apply to Diagnostic Code 7824. Thank you for watching this video. Please don't forget to subscribe and like our videos.